I'm Jana. I'm the registered dietitian here at the Stram Center, and here are some FAQs on our GLP-1 medications. While not everyone makes major dietary changes on GLP-1 medications, it certainly is beneficial, especially if your goal is weight loss. And GLP-1 medications can help enable you to make healthier choices. Everyone's dietary needs are individual. However, it's really important to especially pay attention to protein intake on these medications because when appetite is suppressed, we want to prioritize getting in adequate protein to support lean muscle mass. When there is a dose change, we make sure that a patient has regular nutrition follow-up so that we can prevent any of the common side effects that can happen. And this ensures that every patient is safe while on GLP-1 medications. So the most common side effects on GLP-1 medications are a little bit of nausea, sometimes for some people, and constipation. With nausea, if that occurs, it typically occurs within the first day or two after injection and then usually resolves. With any constipation, that tends to be mostly with people who might have had constipation prior to even starting on a GLP-1 medication, but that's also part of the mode of action of a GLP-1 medication. It slows gastric transit, and so we have many tools to help support gastric transit so that that doesn't happen. We want to work to preserve lean muscle mass as much as possible while on GLP-1 medications. And so to do that, we really emphasize including strength building exercise at least twice a week, ideally 2 to 3 times per week. And that's because if you were to lose weight not on a GLP-1 medication, we'd naturally lose 75% body fat, 25% lean muscle. However, on these medications, you actually naturally lose 50% fat and 50% lean muscle. So we have to work that much harder just to preserve lean muscle mass. So weight loss can plateau while taking a GLP-1 medication, and it can happen for many different reasons. Whether healthy dietary changes aren't being made while you start a GLP-1 medication, or when exercise is not a regular component of lifestyle. It might also signal just that this dose is not the proper dose for that person, in which case the patient discusses that with their provider. While taking a GLP-1 medication, we recommend 2 main supplements. One is a multivitamin, just to ensure that you are getting all of your nutritional needs met, any of those minuscule vitamins, minerals, just to fill in any gaps. We also recommend a specific probiotic that really enhances GLP-1 functioning, and both are available here at the Stram Center. While appetite suppression is one of the main benefits of taking a GLP-1 medication, we don't usually want appetite to be completely suppressed. We want to have a little bit of an appetite, but feel full after proper portions. So it can be helpful to follow a meal schedule. And this is also a key component of what we address in those nutrition follow-ups with the dietitian to make sure that someone is meeting their overall nutritional needs when appetite might not be a signal that someone is regularly receiving. There can be many other benefits to taking a GLP-1 medication besides weight loss, if that's your intention. Some benefits are reductions in inflammation. We've even heard patients have improvements in their skin. And a lot of that makes sense when we talk about the overall impact on blood sugar balance with these medications. When blood sugar is better balanced, we have clearer skin, we have clearer thinking. So a lot of systems of the body improve when blood sugar is really well balanced. If you'd like to learn more about GLP-1 medications, check out our website and read the information below.